Welcome back to the Senior Focus. I'm your host, Nick Kalfas. I'm here with Renee Smith and Mark DiStefano from Bayada Home Healthcare. And before we broke, I had mentioned that I have a client, and she's an elderly woman. She has a sister who's currently in the nursing facility, also an elderly person. They've been together their entire lives. Neither one are married. Neither one has children, and they want to be together. And I think that it's pretty obvious to me that it's going to call for more than just medical services, but also non-medical services. If there were a phone call placed to you that said, look, can you come in and assess the situation, what would happen? What would you do?
Well, I would try to take, or my client service manager would try to take as much information over the phone prior to a nurse going and visiting the home and doing the assessment. That's the starting point. But you would assess the home environment. You would assess it for safety. You would assess it for certainly how comfortable the client and or the family would be with home health aides coming in and out of the home.
Right.
That's a concern also.
Right.
There has to be a comfort level. So that is all done usually in an hour to two assessment meeting. And then what we would determine is what services are needed. Is it personal care? And when I allude to personal care, is that assistance with bathing, dressing, toileting, or would homemaking suffice? And that is more cleaning and meal preparation. Mm-hmm. I also had spoke to earlier, we do have some clients where they really just want someone to come in and spend some time with them.
Right.
Sit on the couch and hold a conversation. Right. That would be companionship. So that's what we would determine during that time of the initial assessment.
So really, if there are people out there and they're facing a situation, somewhat similar to what, I had mentioned, and they would like a loved one to come home, but, they realize that, or they're being told that, more than medical care is necessary here, it's possible for them to make arrangements with you, for instance, so that that care, medical and non-medical, can be provided.
That's correct.
The extent of the cleaning services that would be provided, home cleaning services, let's say that you walk into a place and you think, a substantial amount needs to be done here. Would you want someone to come in, a contractor or something, to do the cleaning and then you maintain the cleanliness of the place? Or would you come in, assess the situation, think, okay, these things need to be done, and then do it?
I think in the initial assessment, Nick, it would be determined to what extent cleaning is going to be involved.
Okay.
We have had a client recently where we were doing the basic cleaning 2 to 4 hours a week,
Right.
but it was just overwhelming for the time that was approved by
Right.
the client and the
Right.
client's family. So we did make the recommendation that maybe a professional cleaner would come in once a month,
Right.
shampoo the carpets, maybe do some basic cleaning on a regular basis, but once a month. That would complement what our home health aides do when they go in there 2 or 3 times a week.
So, basically I'm thinking of the term like light housekeeping and a more thorough cleaning. Is it appropriate to differentiate between the two and say that for purposes of maintaining someone in their home, light housekeeping, being able to maintain the cleanliness of the environment is something that is what you would provide, but as far as like a deep cleaning of the home, they would need to contract with someone who could more efficiently come in and take care of matters.
I think that's a good way to explain it.
Okay.
We would defer to a professional cleaner if it's
Gotcha.
deep cleaning.
I gotcha. Is there a difference in the way that someone would request your services if they were at home and they weren't in a hospital setting, or if they were in a hospital setting, or if they were in a nursing home? Is there a difference in the way that they would come about requesting services?
Sure. If somebody's in the hospital,
Yeah.
lots of times when they're working together with the discharge planner or the social worker, whoever is meeting with them to plan what they're going to need after their stay, whether it's going to a nursing home or going directly to home. At that point, anybody can ask to see a list of home health providers and make a choice that way. If you're going to your physician and your physician says to you, I think I'd like to call a VNA and have some home health provided to you at home, maybe they just put them on some new meds, their diabetes is out of control, they keep falling, chronic respiratory infections, anything like that. At that point, a person could also say, I'd love to have home health, I've heard about Bayada, I think they're great, or whatever agency of their choice, and say that I would like. Otherwise, if people don't speak up, usually an agency will just get assigned.
Right.
And people can even just call from their own homes and make a referral. We do need a physician's order, but for instance, I just received a call from the spouse of a client who has a deteriorating neurological disorder, and she's thinking that he would benefit. Initially, she called saying that she needed personal care services. And then as we got talking, I realized the gentleman has been falling. He's had a lot of medication changes. You know, it really was more appropriate for skilled services at this point. So I, told her how to follow up with a physician to get a referral. So there's lots of different ways. And if anybody has any questions, they can always call our office and we can guide them through the process.
And what number would that be? What number can they call?
The number's 508-853-4100.
Okay, so they call that number, and what would they say?
Just say, I'm calling, I'm interested in home health services. Can you tell me what we might be entitled to or what might be appropriate? And here's the scenario. Sometimes I'll say, yep, that sounds like somebody who needs skilled home health services. And sometimes I'll say, you know what, I think that's more assistive care. Let me send you over to Mark's team.
And I mean, I could be wrong, but when I'm thinking that if a physician were to write a prescription or to prescribe something, refer, the need for services, that pretty much goes to who is going to make payment, right? Even if there's no physician involved, someone could probably still give you a call and arrange for things, right? They don't have to have a physician. They can private pay and they can have you provide service, right?
Actually, you could private pay for skilled and unskilled if you wanted to, but most people do have an insurance benefit that would cover the skilled services. Yeah.
The idea of patient choice is really a big point. A lot of times during, the hospital, I don't know that you're made aware of the choice that you have. I think pretty much, more often than not, you're given a rather restrictive list. These are the people that you're going to be able to choose from. Who would you like? Or, I've heard occasions where people are told that, you're going home and this is going to provide the care for you. They're not given a choice at all. They're told is going to provide the care.
Right.
That's not what the law is it?
No.
And the law is that they can choose whoever they want.
Yeah, and they have to be provided with a list, and that each facility making referrals has to maintain an updated list.
So in the event a person's in the facility, in the hospital, they're about to be discharged, and they're told, hey, this is who's going to provide care, they can ask the discharge planner, whoever it is they're dealing with at the hospital, for a more comprehensive list. The person can, look at the list. We'll say do their due diligence. They can make calls and they can find who they're more comfortable with.
Right, right. The other thing is if somebody knows that they're going into the hospital, or even if somebody is in the hospital, say somebody's in the hospital and their loved ones and they are discussing home health after their hospital stay, at any time, anyone who wants can go to Medicare.gov and rate the home health agencies in their area. We are all subjected to the same outcome criteria. If you go to Medicare.gov and you search by your zip code and you select multiple home health agencies in your area, you can compare us on how our patients do and how often our patients return to the hospital and what our patient satisfaction is like.
You know, that really is a very valuable thing for people to be able to go online, like you say,
Medicare.gov. Yeah.
Medicare.gov, and do their due diligence, take a look at the particular agencies that they might be interested in, compare them, like you said, and make a decision.
Right.
Most people have no idea that that's available.
Right.
In fact, I didn't know that it was available until today, to be honest with you. But yeah, it really is a very wonderful thing for people to be able to assess not only one agency, but whatever agency they may be interested in, and it's all right there.
Right.
We're going to head to a break. When we come back from a break, I do want to delve a little bit deeper into the types of medical services, medical care that's available.
Okay.